Okay, my name is Dr. Prabhakar, and since there is a lot of buzz about coronavirus, and since there is no particular treatment for the coronavirus, and sanitation and cleanliness is the only way we can protect ourselves from coronavirus, I made this video explaining what kind of face mask you need, what kind of hand sanitizers you need, and how long you need to, or how many times you need to use the hand sanitizers in a day, and how long you need to use the soaps, or and how many times you need to wash your hands in a day with the soaps. Okay, so first thing is hand sanitizers. Okay, on an average, this 25 ml hand sanitizer, it costs 40 rupees on an average. If you use this in a day, you can use it for 10 times at best 10 times. But if you go out and if you do your normal day, I suggest you need to use at least 30 to 40 times. So what it means is, as soon as we apply some hand sanitizer, we kill some germs, but hand sanitizers has been proven very ineffective in killing viruses. Especially it can kill 99.9% of germs, or it may kill 99.9% of germs, but there is no record of hand sanitizers killing any kind of viruses. Hand sanitizers, on an average, if you apply hand sanitizer like this, if you take this amount, and if you use like this, it will last for up to 15 to 20 minutes only, because as soon as the alcohol dries up and there isn't much left for killing viruses, especially when the hand sanitizer is very poor in killing viruses. So using a hand sanitizer for 30 to 40 times in a day, it is not recommended. Although it is necessary, it is not recommended because sanitizers left in our states or in our country. So hand sanitizers is not a very effective way to kill viruses. Then the next prevention is face mask. Let's look at it like this. We apply our face mask like this, but there is a strong possibility the face itself is exposed to the virus. In case you are staying near someone who is getting or who got infected. Even in China, it is not recommended for everyone to use face mask, because although face mask seems to be reasonable and logical, they don't really protect you from the virus. So I suggest you buy a handkerchief and try to cover almost as much as of your body you can, and especially if you are near someone who is suspected of coronavirus. And I suggest you buy at least 20 of the face, at least 10 to 20 of these handkerchiefs, and wash them with Dettol or soap water and dry them. And as soon as you feel like you are exposed to the virus, or as soon as you came from outside of your home, you go and wash the handkerchief with Dettol or some kind of antiseptic liquid. The reason behind this is, even though the virus can live up to 24 hours in a dry surface, it is not proven that how long it can survive in a wet surface. If it is wet, the virus may live a longer time than the expected 24 hours. And if I have to remind you, that is, the virus is not infected. We don't get infected from air. We just get infected from droplet infection. Droplet infection means if someone sneezes on you, if someone is infected with corona sneezes on you, then you will be getting infected with the infection. If the infection goes into your eyes, nose, and your mouth. You see, generally our body is covered with skin. Skin might seem something else, but skin is the wall, protective wall for our body. As long as there is no cut on my skin, I don't need to be afraid of touching any kind of dirt. But as long as there is a cut on my skin, I cannot even touch anything, because if we look on an average, if I have to search this place, I can at least find couple of millions of microbes, including some kind of difference of viruses, bacteria and funguses. So as long as the skin is intact, I don't need to be afraid. But once the skin is exposed, once the skin is cut and the blood vessels is exposed, then I need to be getting worried. So this is the logic behind protecting yourself from the virus to enter into your body. So the third thing is hand wash. Out of the three protective measures, only hand wash is very logicable and very doable. Okay. The reason behind this is coronavirus is made from a coronavirus is a virus, and all the viruses and bacteria have a outer cell wall. If we can destroy the cell wall, we can easily kill the virus. As long as the cell wall is intact, we cannot easily kill the virus. Even with antibacterial sanitization liquids, we cannot kill the cell wall. But the way we can kill the cell wall is by using soap water. Okay. So not because it has some antibacterial properties, it has a property to destroy, or on an average, you see, if after eating a meal, our hands is very oily, and if we apply some hand wash liquid, and if we wash our hands completely, then the oil is gone from our hands. Okay, that is the same logic we use against the viruses. You see, the outer cell wall is made from a lipid layer. Okay, lipid means nothing but fat. So when we mix this fat with soap water, it is very easy to break this liquid, and once the cell wall is exposed to the air, once the cell wall is exposed to the soap water, it is very easy to kill the cell. Okay, so the leftover is, as soon as we wash our hands, the leftover will be gone with the soap water. Okay, so obviously for this process it takes at least 30 seconds or 20, more than 20 seconds. Okay, so you need to wash your hands for at least 20 seconds, but I recommend 30 seconds. Okay, and you need to wash your hands up to here, not here, not here, not just on this side. You need to wash up your hands up to here, just as the surgeons do before going into the surgery or operation theater. Okay, so these are the three ways you can protect yourself from coronavirus. So please do wash your hands more often. At least I recommend 10 to 15 times in a day. Okay, so I hope you learned something. Thanks for watching this video. Please do like, share and subscribe.